Okay, ladies and gentlemen, I have good news. Now, good news I go call am abi na bad news. Or shake is a verb. Now, so they talk am according to Ogoman. All of you looking for visa, care worker visa, and health worker visa, when I go take Japa go UK. When I don't already dey plan dependent, even those of now when never marry, when I dey force dependent plan by all means. So people dey carry their brother go, say na their husband. Anyway, as of today, Odiodi for you, it don't end. Amen? It has ended. The UK government said you can no longer bring in your dependents if you are a care worker or a health worker. If you BBC, Punch newspaper, according to Radio Nigeria, let me show you the gist. The United Kingdom government, in its newly introduced laws to cut migration and tackle care worker visa abuse, has restricted foreign health workers and caregivers from bringing dependents into the country. In a statement released on Monday by the UK Home Office, the measure is to tackle the influx of migrants. New rules are to radically cut net migration and tackle visa abuse are now in force as part of the government's plan to bring down unsustainable levels of legal migration. Care workers will now be restricted from bringing dependents after a disproportionate 120,000 dependents accompanied 100,000 workers on the route last year. According to the statement, health workers acting as sponsors to migrants are now required to register with Care Quality Commission. Care providers in England acting as sponsors for migrants will also be required to register with the Care Quality Commission, the industry regulator for health and social care, in order to crack down on worker exploitation and abuse within the sector. It forms part of a wider package of measures which is being implemented as soon as possible, which means a total of 300,000 people who were eligible to come to the UK last year would now not be able to do so, the statement adds. Now, number one, no be only Nigerians that they stop from bringing in dependents. It is everybody, anywhere you go in this world, you are entering UK as a care worker or as a health worker, you can no longer bring in your dependents. Because last year, 100,000 people get visa, 120,000 dependents that follow their call. UK say they can no longer sustain that population of people coming in legally, so they have stopped it. Now, those of you where they UK already, when they already be sponsor, when be health worker and caregiver, when get dependent, you are supposed to now register with the Care Quality Commission for you to keep your dependents in the land. Now, this is it. Let's say you be health worker for Nigeria here and you won't go UK. The company when one employee is going to give you what they call certificate of sponsorship. That certificate of sponsorship allows you to come in as a health worker and bring in your dependents. Now, Nigerians, whether they as agents, this is what they do. They collect the certificate of sponsorship. They'll call seller for who need a year. We don't know where to work out. They are selling as high as 14 million. Now you will be health worker for Nigeria. Now you go buy your certificate of sponsorship like 14 million. You can't find dependents who will follow you go. On a come quickly run one kind mago marriage. Dependent can follow you. That one go pay 7 million. You go pay 7 million. Or if you tell them may pay 10 million, based on say now you be the health worker now. Then you go pay the balance. 12 now go. Some people when know you go allow you travel. Then you go pay small. Some you go pay your full money from here before you come out. Now, this is my problem. How can you have 14 million and you the jackpot? Are you joking? You have 14 million, you the jackpot for real? With 500,000, I will open a POS shop. A POS shop will give me at least 100K every month in profit. With 5 million, I will open 10. That's 1 million every month in profit. Why will I name Nigeria? 1 million every month. I will not go to UK and go and be hustling. Some of them you see going to the UK, if you see the guy work there, they go do non-menial jobs. But the thing is, even if they do menial jobs, with the menial job money, they will pay house rent, eat, still 6 months is sent, come back to Nigeria, and they are at peace. It's a working system. If Nigeria was a working system, nobody will leave this country and go and be doing all those menial jobs in the UK. Bro, some banksters, they come on Nigeria, go do menial job there. Some will go with student visa, carry their dependents, You when you be student, you can't work more than 20 hours a week. Now your dependents go the hustle. So the whole load will be on your dependent. Maybe you carry 2 children follow, but you go to take care of everybody because how much do you want to make 20 hours a week? These are the issues. But now they're not stopping her from going now with her dependent. The way people go take boycott UK. The way Nigerians go take boycott UK. The way they face country like Australia. And more people now come face Canada. So because they also to go Yankee, you see, stay here. Let's fight for a better country. Let's fight for Nigeria to be good. Now, because those of us who they quarrel for this country to be good, not plenty rich. Now, many politicians say they use us play. Once our hands join together, we fight for a working system which will work. But most times when Nigerians they behave, say, be like say we never really want working system. We just want system where favor us. Now, make even for the UK, those of them we don't go. See, they do mago, they sell certificate of sponsorship. Something will be free, where the company will give you free. Yeah, also. Anyway, I just make I bring you the news because some people they say no be health worker, now only caregivers from where only caregivers, people where they sponsored by NHS. From the news is both health workers and caregivers. Mona John Mona.